We hear so much noise, really, about health care law. The real news about it can get drowned out. News like this. A new study finds 10 million previously uninsured Americans got coverage under the law. 10 million. Before Republicans were fighting to take the idea of health care away, now they'd rather take away the real coverage. They cheered when a court ruling threatened subsidies for millions of Americans. And today, the New York Times profiled people that ruling puts at risk. Like Gloria Spotswood from Virginia. She receives a subsidy to help pay for her plan. And at the thought of losing her subsidy, she says, "I'm scared." Sitting in the lobby of her condominium building here, because her air conditioning had broken and she didn't have the money to fix it, she said, "I don't see how, in all honesty, I would be able to afford to pay the whole thing." They also spoke to Mary Katsky, an independent filmmaker in Anchorage, who said there is no way she could pay for the policy without her subsidy. These are real people relying on the law.
ECU senior Kristen Ziegler says her 19-year-old brother and parents who are in their 60s have all signed up under the ACA. She says she's hoping the benefits she's received under the law will not be affected by the court rulings.
With this, it's easier to find doctors and pharmacies I can get my medication at.
If something happens, I have a place to turn to.
That reassurance could fly out the window if a federal court of appeals ruling sticks.
Glenna Kaplan takes a pill every day to lower her high blood pressure.
I thought I was pretty healthy.
She started taking the pills after going to her first well-checked doctor visit in 12 years after getting health insurance through the Affordable Care Act.
If there was no subsidy, I'm done. I can't, there would be no insurance. I can't do it.
So let's cut through the politics and focus on helping these real people. Joining me now is Ann Philippic. Ann is the president of Enroll America, a nonprofit group working to get more people enrolled in plans under the Affordable Care Act, and Democratic strategist Jamal Simmons. Thank you both for being here tonight.
Thank you, Rev.
Hi, Reverend. Thanks for having me.
And you work with people who've gotten covered under the law. How would they feel if they thought their coverage was threatened?
Well, we hear stories every single day, like the ones you just showed, of people that for the first time ever got access to coverage that they could actually afford. And we've heard stories of people that, of course, are concerned by hearing about this court case. The big thing we're making sure all consumers know is that nothing's changing for them. No one is taking their coverage away, and no one is taking away that financial assistance. And we're confident that at the end of the day, this case is going to be dismissed.
You know, Jamal, I mentioned that New York Times story about people worried about losing their health care subsidies. One woman said, quote, "For people like me who have health issues and have the opportunity now to actually have some health care, we will fight tooth and nail to make sure we can keep it." Will people start to hold Republicans accountable for working to take away their health care, Jamal?
I think that average, everyday Americans are going to start to hold Republicans accountable for taking it away. Now, when we talked about it in theory, what might happen in the future, what Obamacare might do, there was a lot of ability for Republicans to scare people. Now people have been through the process, and they actually have this benefit. They're starting to benefit from it. They're taking advantage of it. Their kids are taking advantage of it. And you want to take that away from real Americans? I think that's going to be a political problem. So if I'm a Democrat, I'm talking about Gloria Spotswood. And the Republicans want to attack Democrats, but they ought to be attacking problems. That's what I'd be out there saying.
You know, and what occurs to me in researching this is it's not just more people are getting coverage, but it's the people that already have insurance that are getting better deals. Today, the Department of Health and Human Services reported the American people have gotten $1.9 billion in refunds from insurance companies since 2011. Are more people starting to understand the law's benefits, Ann?
Well, yes, and you mentioned the New England Journal of Medicine report from earlier this week that showed that over 10 million Americans who were previously uninsured have gotten that coverage through this first enrollment period. But this is really just one of a long list of evidence that's showing that the ACA is working. You know, we saw a Gallup survey last month that came out that showed that the uninsured rate in the country is at the lowest it's been since Gallup started tracking it, at 13.4%. You know, HHS put out a study showing that for all those Americans, those millions of Americans that got financial assistance, the average premium they're paying each month is $69. And Commonwealth Fund put out a survey showing that 80% of people that have used their coverage are happy with what they've gotten. So what we're seeing here is fundamentally story after story, study after study is showing that the ACA is working and it's affecting real people.
You know, Jamal, Republicans are giving the same responses to questions about health care that they gave 4 years ago. Listen to Speaker Boehner today.
You know, the discussions about Obamacare and what the replacement bill will look like continue, trying to build consensus around one plan. Not there yet.
I mean, he's still looking for a replacement. I mean, check out how Senator Ted Cruz reacted to that ruling that came down and that would threaten subsidies. Listen to Cruz.
It rejected President Obama's lawlessness with regard to Obamacare. Now, the matter will still be appealed, so it won't go into immediate effect, but I think the ruling was correct. And it highlights the brazen lawlessness of President Obama with Obamacare.
Now, he's using the ruling to attack President Obama. Could that be used by the Democrats in the midterm elections? Language like this that Cruz is using?
I think the reality is most Democrats probably won't run on Obamacare, but when they are attacked on Obamacare, they need to have a ready and strong defense to go out there and talk about these individual cases like we just said a minute ago. I mean, when you think about what the Republicans have just said, they're still trying to come up with a health care plan. They passed this plan 5 years ago. I mean, it's been forever. We've already had 2 national elections. We're on our 3rd election since health care passed, and they now are still trying to figure out what their plan is. Again, Republicans are talking about attacking Democrats. They ought to be attacking problems, and the Democratic candidates ought to be out there holding their feet to the fire for not coming up with any solutions that actually benefit people.
But, Ann, it keeps coming back to me that this law is about real people, real people. I talked, for example, to a lady named Spike Dolomite Ward, who says the law has been a lifesaver for her. Listen to this.
My life is literally being saved by the Affordable Care Act. I'm halfway through my treatment now for stage 3 breast cancer, and I'm responding very well. There are no death panels. Nobody's messing around with my health care. I've got the best doctor, and he's taking very, very good care of me.
I mean, do you hear a lot of stories like this, Ann?
We hear these stories literally every single day, and it's exactly that. People that say, my life was saved because of this opportunity. And I think something for us all to remember is, as proud as we are and as much as we want to protect those millions who have gotten coverage, there are millions more Americans who have the opportunity to enroll but have no idea it's available to them. And a lot of these conversations get really confusing. And so what we all need to do, I think, is come together, leave the talk of repeal behind, and really focus on implementation so we can make sure that every single American who has this opportunity knows about it and actually enrolls in coverage.
And let's hear some more stories about real people that are really getting help. And Philippic and Jamal Simmons, thank you both for your time tonight.
Thank you so much.